Good afternoon, dear colleagues. I would like to present abstract of our publication entitled High-Risk Human Papillomavirus Prevalence Among Patients with Cervical Cancer at Moewardi General Hospital in Surakarta, Indonesia. Introduction. In Indonesia, cervical cancer is the second most prevalent type of cancer among the general population. Cervical cancer has the second highest mortality rate of all cancer. Infection with the human papillomavirus is one of the causes that start the growing phase of cervical cancer. The purpose of this study, therefore, is to determine the prevalence of HPV infection in patients with cervical cancer who were examined at Dr. Moewardi Hospital and live in the ex-Surakarta residency. Methods: cervical tissue biopsy at the anatomical pathology installation of Dr. Moewardi General Hospital, Surakarta, which has been diagnosed as cervical cancer, was examined by the detection of E6 protein from HPV-16 and HPV-18 using immunohistochemical staining technique. The data obtained would be analyzed based on characteristics of the patient age and the degree of histopathological malignancy, with the p-value less than 0.05 deemed significant. Result: overall, the prevalence of high-risk HPV infection was 77.8%, with the women aged between 41 until 55 years having the highest prevalence of HPV infection, 45.7%, followed by women aged 66 until 70, 42.9%, women over 70, 8.6%, and women under 40, 2.9%. The result of statistical tests showed that no significant relationship was found between HPV infection and age. P-value is 0.428. High-risk HPV infection was most prevalent in the poorly differentiated group, 55.3%, followed by the well-differentiated group, 34.3%, and the moderately differentiated group, 11.4%. The result of statistical tests revealed a significant association between HPV infection and tumor grade, with the p-value is 0.027. Conclusion: to lower patient morbidity and mortality, it is crucial to receive a prophylactic HPV vaccine due to the incidence of HPV-16 and 18 infection in patients with cervical cancer at the regional hospital Dr. Moewardi Surakarta, with a prevalence of 77.8%. The keyword: cervical cancer, HPV, and ex-Surakarta residency. Thank you very much for your attention.